I love PHP and all the information and that sort of thing. It's my go-to place when I'm looking for resources. And for a lot of family members that are involved in advocating for a person with a disability, I'll tell you, it's hard to find anything that matches what PHP has. I want to begin the presentation, and some people might call this the creepy part of the presentation, but I want to introduce Kathy, okay? So for some of you, and I want you to imagine this as we get into this. Imagine that you have a child with a disability. Imagine that Kathy's 17 years old. This 18 is a very important time because we're dealing with public benefits, we're dealing with conservatorships, we're dealing with supported decision making, we're dealing with a lot of stuff here, and that's why these transition programs are so important. But before we get into the public benefits part of this, benefits and disability advocacy is not something that doesn't change, okay? I've been doing this type of work arguably my entire life. I have watched the system for the last 60 years. I know some of you are looking at me and thinking, well, I couldn't possibly be that old, but actually I am here. And I have seen tremendous changes over that period of time. Now imagine if you have a 17-year-old with autism, for instance, somebody in the spectrum. To my knowledge, nobody has ever died of autism. So if Kathy is 17 years old, she's expected to live until she's 87 years old. So whatever you're doing, let's say you set up a trust, you set up a system or whatever, and you set up all the advocates to work as the supported decision maker, the conservator, the trustee, whatever all these players are, the number of changes that are likely to happen over Kathy's lifetime, which would be another 70 years, okay? Things are going to change. So here's what I want you to keep in mind as I go through this. I'm going to go through public benefits and ABLE accounts according to the law as they are in 2022. How many people out there think that the rules will stay the same for the next 70 years? Okay, and obviously I can't see you, you can only see me. But if anybody put their hands up, you're really kidding yourself. Laws are changing, and laws are changing now. So here's the thing with this. And one thing I like to say, there's kind of an equation that disability and simplicity are two words that just don't go together. And this is one of the reasons why you really got to keep up on this stuff. And here's the other thing that's really important, especially in California with the programs that we only have them because of persons with disabilities and families that advocate here and make sure that these things happen, okay? So I just want to start off with that introduction because we always need to make sure that we can adjust to whatever changes are going to happen. Let me plow through this as best as I can. And the other part of this is you'll notice here that I'm doing this as the trustee of the Golden State Pool Trust. And if you go to www.gspt.org, or if you go to the YouTube channel that's listed there, for instance, on ABLE accounts, we have something like 4 hours of materials on ABLE accounts. Did I mention that disability and simplicity are two words that don't go together here? And so really, it's always about education, education, education. And that's what PHP does such an excellent job of helping us all try to get through this quagmire. Okay, so let's go on through the presentation here as best we can.
Steve, I have a question. There is a comment on the chat asking if you can put your slide in presenting mode.
Hold on. Does that make a difference?
So they can see better.
Is that better?
I think so.
Okay.
I can see it bigger. Yes.
And
Thank you.
As far as questions are concerned, according to my time, I have 57 minutes and 45 seconds. if there's questions, I want to have as much time for questions as I can. It's probably best to hold the questions until the end, if that's okay, unless there's some burning thing that we need to deal with. Okay, I think we have time for questions if we don't get bogged in. Here's the first thing when we're dealing with public benefits, and let me mention this. Usually it is when your child turns 18, the public benefits become important. Now, it's not that children don't qualify for public benefits beforehand, but there's a thing called parental deeming. And in most cases, the reason that most children don't get SSI here until they turn 18 is the parents' assets and resources are deemed to the child. At age 18, that ends here. And the child is judged on their benefits on their own as a separate individual, okay? So for the vast majority of families, for instance, SSI does not begin until age 18, unless the family have incredibly limited resources. And there may be some folks on this webinar where they're underage, their children under age 18 are getting public benefits. The vast majority of folks, that's not how it works, okay? And it's called because of parental deeming. So there are two, this is one of the things that often get confusing about this is that there are two types of public benefits. And many of these are under the umbrella of the Social Security Administration. But if you tell somebody that they're getting some sort of Social Security, that's only telling you that it's something administered by the Social Security Administration. It really doesn't tell you the kind of benefits they're on. So there are two types of public benefits, and we got to figure out what kind of public benefits we're dealing with. For needs-based benefits, which is where we're going to spend the majority of our time, the primary program is a program called Supplemental Security Income, or SSI. Okay, but other programs include Medi-Cal here, food stamps, legal aid, utility payments here, housing subsidies like HUD and Section 8, and that sort of thing. Now, what's common with those programs is you have to show a need based on there being a disability, but you have to show also that the benefit recipient has limited income and resources. And we're going to go through this in a lot of detail. The other kind of programs are programs like Social Security Disability Insurance, or SSDI, a program, especially since so many of you have children that are developmentally disabled here. Many of your children will eventually be on a program called Childhood Disability Benefits, or CDB, Medicare, and for instance, special education is an entitlement as well. Now, what's common with these programs is you have to show a need based on disability, but there are no income or resource limitations. So for these programs, your child could win the lottery and they would still stay eligible for these programs. So we're going to plow through this. By the way, it's great that this is being recorded, because oftentimes for families, if you're not used to this kind of thing, you may want to listen to this more than one time. Also, if you go to the YouTube channel or here, this very same program, you'll find it as well. And sometimes you may want to watch this more than one time. Here. So there we go. So let's imagine you have a 17-year-old daughter named Kathy who has a significant disability. Kathy's likely to have need some level of assistance for the rest of her life. And we should stop right here. Let's assume Kathy has autism, okay? Now, as the old saying goes, if you've met one person with autism, you have met one person with autism. What does that tell us? She could be Elon Musk. She could, be somebody who has complete needs, or somebody in between, and that kind of thing. And not all persons with disabilities are going to need assistance for the rest of their life, or maybe they won't even need public benefits. We have to treat them as individuals. here. So, once again, you have to fit this to the individual. So you come to the estate planning attorney to provide for her needs in the event of her incapacity or death. And as I had said before, Kathy is otherwise healthy and is likely to live 70 years or longer. Once again, I do not believe anybody has ever died of autism. That's just not how it flies. Okay. So some of the things that are going to come up is benefit laws are going to change. Okay. And we don't have a lot of time to go into it now, but even our Medi-Cal or Medicaid laws are going to change here coming up next July. So one of the things is you must always be vigilant because these rules are not static. Social service systems will change. For many of us, that's through the Lanterman Act. And once again, I am a big fan of the Lanterman Act. The only reason we have the Lanterman Act is because of advocates like you and advocates that came long before you who insisted on this. This was not something the government did because they wanted to help folks with disabilities. I'm sorry, that's not how it works. They did it because our community insisted on it. And by the way, if we ever stop advocating, then we will probably lose a lot of those programs. Her condition may change, right? I worked for a number of years in the Northern California Autism Program at Napa State Hospital. When I was a nurse, we had 100 patients. We were told that was the entire population of Northern California. Obviously, that's not true here. And not only conditions or how we label folks or how we, categorize folks, those change. And we have a lot of folks that are in the spectrum, and I know there are other disabilities we deal with that are folks that are doing things we would never have dreamed of 30, 40, 50 years ago. Her advocacy system may change. And for many of you, the advocacy system are the natural supports. They are the family members themselves. And, part of what you should be thinking about as you're going through these series of programs is, if Kathy is going to need assistance to advocate for her needs, how are we going to make sure that support system continues in one form or another? Attitudes may change. Fortunately, we have seen more and more focus on accepting citizens with disabilities into our communities. It could go quite the other direction, and we must always be vigilant about that. Question I get all the time, because we do special needs trusts, is how much should I set aside for a loved one with a disability? And the answer is, quite frankly, there are so many variables, it's impossible to give a real number. So once again, consider this: as long as our system continues and functions properly, maybe the amount of assistance Kathy may need may be minimal. If she moves to another state that doesn't get the same amount of supports, or God forbid, let's hope this never happens, but if the Lanterman system fails, which is not impossible, here the amount of resources she's going to need is going to be astronomical. And then as far as who's going to be involved in helping her make decisions in her life, that is going to change. So let's go back to this. If we go to the different types of benefits we're dealing with, going back to the difference between entitlements and needs-based programs, our cash assistance program here for needs-based programs is SSI, or Supplemental Security. And what we're going to learn is if you get at least $1 of SSI, you also qualify for Medi-Cal. And in many times, it's the Medi-Cal that's more important than the SSI. And I'll say this right now: keeping the SSI is not the only way to keep the Medi-Cal, but that's one of the most common ways of doing it. When we go to entitlements, the two entitlement programs we're going to talk about are SSDI and childhood disability benefits. And tied to that, the medical program tied to that is Medicare. It's very possible that many of the folks that are disabled that are watching this, or many of your children, if you're a family member or an advocate, there may be a time when they'll be on all four programs at one time. And what I want to kind of go through is how that's probably going to work. So let's go to the granddaddy of all the programs, SSI. What is SSI? SSI is a federal program administered by the states It's based on showing a sufficient evidence of disability and financial need. And this is really important. It's intended to pay for food, clothing we don't count any longer, and shelter, and nothing more, okay? And for $1,040.32 a month, your loved one is supposed to pay for their food, clothing, and shelter. For instance, in Santa Clara, California, each month. Good luck with that. I mean, those numbers are ridiculous here. But basically, that is what the SSI is meant to do. So there is a three-part test when we're dealing with eligibility for SSI. The first test is you have to meet the definition of disability. The second test is that an income test where you have that determines how much the benefits recipient can get. And the third test is the resource test, which determines whether or not you're eligible. So let's walk through this. Meeting the definition of disability. So in order to qualify for SSI, and this is one mistake oftentimes families make, okay, which is, of course, we are proud of what our disabled loved ones can do. You know, we want to brag about them and all of that, except when you're making an application for SSI, because merely having a diagnosis of cerebral palsy, for instance, or of Down syndrome, or autism, or whatever, that is not going to get you the public benefits. Okay, that's the first step. But really, it is there's a couple of things you have to do. You have to be under the age of 65. After 65, there's a whole new process. And not be able to engage in what's called substantial gainful activity because of a physical or mental impairment that's expected to last a year or longer or end in death. One of them, what the Social Security is really focused on when they're determining whether or not your loved one is eligible for SSI, they're looking at whether or not they're able to engage in substantial gainful activity, meaning can they work here, can they support themselves, and that's what they're focused on. And in 2022, the SGA amount for somebody who is non-blind is $1,350. Okay, so basically what they're focused on is, can your loved one earn more than $1,350? And if they can earn more than that for a longer period of time, then at least initially they're going to be found to be disabled. Now I'll mention this right now, and oftentimes these rules are confusing. You hear all the time that people that are on SSI shouldn't work and that kind of thing. That is absolutely not true here. That's not really what we're going to focus on. So anything I say, if it discourages folks from working, working is, for many folks with disabilities, is the avenue to true independence. There's all sorts of rules and things like that, and you want to learn about all of this here. But going back to the basics about this, initially, in order to get qualified for SSI, you have to show that you have a disability that's going to last a year or longer or end in death, and that the SSI recipient is unable to earn more than $1,350 a month. And other programs, I could show you how after you do that, they can earn up to like $40,000 a year and still stay on the programs. I know that doesn't make any sense. That's not uncommon when we're dealing with disability advocacy. So the next test is the income test, which determines how much you can receive. Okay, so there are three types of income that we're dealing with when we're dealing with SSI. So the first one is pretty straightforward. If you're on SSI and the benefits recipient receives any cash directly, it'll reduce their benefits dollar for dollar after the first $20. So let me give you an example. I have a niece with Down syndrome. We set up a special needs trust for her. By the way, we set up an ABLE account for her and all of those different things. But let's say that I decide that what I want to do is set up an annuity, and I want to make sure that my niece gets $100 a month to do whatever she wants. And I'm just going to have that annuity send her $100 a month every month so she can use the money. Here's the problem. After the first $20, her benefits will be reduced dollar for dollar, so they're going to reduce her SSI by $80. Basic rule is for folks that are on SSI, you cannot give them cash, okay? And that's why so many the other tools are so important, including what we're going to talk about a little bit about is the ABLE Act. And this is one of these areas where the ABLE Act can be really helpful. The other one is if you earn it, you lose $1 for every $2 you earn after the first $65. So let's go back to Kathy. Let's say in the month of January here, Kathy earns $265. They don't count the first $65, okay? But then for everything after that, they reduce her benefits for $1 for every $2 she's earned. So she would lose $100 of her SSI. But if you do the math, she's $165 ahead. Once again, that's one of the more simple explanations about working. And there are so many other programs that can help her, like the 250% working disabled program and all that, but we don't have time to get into that today. But the basic rules are if you earn it, you lose $1 for every $2 you earn after the first $65. Here's the third one, and this is the one that is the most confusing. What if you have a loved one with a disability that is on SSI? Let's say it's your child, and you say to your child, here, you can live in my house and you can eat my food, and I'm not going to charge you rent. Here's what Social Security does. It says, cool, we don't have to send Kathy all this money. We're going to reduce her benefits by $300.33. Now you go, that doesn't make any sense at all, does it? Well, here's the reason for this. The federal part of the SSI is literally 1/3 for food, 1/3 for clothing. We don't count any longer. We haven't counted that since 2005, but it's still part of the equation, and 1/3 for shelter. So the concept is if your child cannot pay you fair market rent for their shelter, and if you're assisting them in putting a roof over their head, then their benefits are reduced dollar for dollar, capped at $300.33. I know that doesn't make any sense. I hope that goes away someday, but it's a real thing. And we're going to cover that a little bit more. So here's the last test, which is the resource test. So the amount of resources you can have determines whether you're eligible. So let's go through that. What's a resource? Anything you can convert into cash as a resource. And if resources exceed $2,000 on the first moment of the first day of the calendar month, then the person is not eligible for benefits that month, okay? That number hasn't changed since the 1980s. And my understanding is if we had even a conservative cost of living increase, that number should be somewhere around $18,000 or $20,000 here. For those of us that are old enough, and I certainly am, remember in 1989, the cost of gas back then and the cost of gas back now, we're dealing, this 2,000 resource limit is dealing with 1989 numbers, but unfortunately, it's still true today here. So the resource limit continues to be for SSI $2,000. Now there's exceptions to that. One of the biggest exceptions is that a person on SSI can own a residence of any value as long as it's a residence they live in. By the way, those of you that are looking at leaving a residence to a person with a disability, while you can do that, in most cases, it's going to be a lot better if you put it in a special needs trust. And if you go to my YouTube channel, what you will find are programs on how to leave a house to an individual with a disability. And if you have the resources to do that, that can be a wonderful thing to do, especially if you get ILS and SLS services around that. And if you don't know what that is, well, there's a lot of education for you coming up here. But you just really need to be smart about how you can do that. If you just want to ignore it, you can leave a person on SSI or any of the other public benefits, a residence of any value that they live in here without interfering with their SSI. But on the other hand, they're going to have to maintain that house on $1,040 a month, including feeding themselves. And that could be somewhat of a challenge. In that house, they can have all the household goods they like, including clothing. Okay. And that's what changed in 2005. Okay. And that's when the clothing rule went away. So they can have refrigerators, they can have art, they can have instruments, they can have all sorts of junk here. And there really is no limitation on the value of those things. If it's held for their intrinsic value, so for instance, if you're holding Renoirs and Monet paintings here, that's probably not going to work. Okay. But on the other hand, most household items, there's not going to be a problem. The other thing is a person on SSI can own an automobile of any value. Okay, there's no limitations on the value and that sort of thing. And that's very common. They can also own any item related to the disability, and that just kind of makes sense. They can also, and this is what the person with the disability can own. Okay, so the person with the disability can own a life insurance policy in their own name, but it can't have a cash surrender value greater than $1,500. Now, if there's any financial professionals watching this out there, you're probably scratching your head and thinking, how would you do something like this? This would be like a variable life or a whole life policy. Remember, these rules haven't changed since the mid 80s, and they're sorely out of date. The person with the disability can own any amount of term insurance because it really doesn't have a cash surrender value. They can own a burial plot of any value, and that includes a crypt or that kind of thing. But they can only set aside up to $1,500 of their own money as far as the burial expenses. Okay, so one of the things with SSI, and obviously the value of the SSI is it does get cash to the benefits recipient here, is that if you get $1 of SSI, you get to keep your Medi-Cal without a share of cost. Good friend of mine describes the Medi-Cal, and what we're talking about is what's called aged and disabled federal poverty level Medi-Cal. That's the kind of Medi-Cal that pays for long-term care, pays for in-home support services, and that kind of thing. And that's usually the type of Medi-Cal we want to have here. He describes the Medi-Cal without the share of cost as the good Medi-Cal, and the Medi-Cal with a share of cost as the evil Medi-Cal. And if you've ever been on share of cost, you know exactly what he's talking about. We want to be on the good Medi-Cal, not the evil Medi-Cal. So let's talk about Medi-Cal. Now, there's many types of Medi-Cal, and we're going to talk mostly about aged and disabled federal poverty level Medi-Cal. That's the most common one that we use. There's many different types of Medi-Cal. There's the 250% program. There's Obamacare or ADA Medi-Cal. There's all of that. We're going to be talking about disability-related Medi-Cal. So what does Medi-Cal cover? It covers inpatient hospital services, outpatient hospital services, home health care, physician services, laboratory and x-ray services, dental services, and some regional center services are assisted by Medi-Cal, and some are purely entitlements, okay? But in many cases, it's the Medi-Cal that may oftentimes be one of the most valuable programs to maintain, depending on the individual. So let's go to the first of our entitlements. Okay, so the primary entitlement is what's called Social Security Disability Insurance. And for any of us who are working, we're contributing to the system. And the Social Security Disability Insurance Program is a national program for injured workers that have the requisite number of work credits into the Social Security system. Okay, so in many cases, for instance, if I were in an accident on the way to work here, and if I were injured, because I've been putting into the system for quite a long time, I would probably qualify for Social Security Disability Insurance, assuming that I'm found to be disabled. Okay, so SSDI has no income or resource limitations here, so I could win the lottery once I'm qualified for SSDI, and it's not going to interfere with my eligibility here. But earned income could cause ineligibility because it's under the same rules, which is I have to prove that I have a disability that's likely to last a year or longer or end in death, and that I'm unable to earn the SGA amount. This program, and this is the one that we want to pay particular attention to, especially for those of us who have loved ones with a developmental disability, is if the disability began before the age of 22, your child could be qualified for a program called Childhood Disability Benefits. Okay. Now, for those of us with that have a level of this with a developmental disability, that's not hard at all because by definition, the disability began before the age of 18. So that should be relatively simple for most of this group. Benefits are not payable until a parent dies, retires, or becomes disabled themselves. And the child has to have not performed substantial gainful activity before since the age of 18 to qualify for this. Social Security or childhood disability benefits are not affected by the child's assets. Once again, on these programs, your loved one could win the lottery, not going to knock them off the benefits, but if they earn more than SGA, they could lose the eligibility for those benefits. So let's go through how this works. Upon the disability or retirement of the parent, an eligible disabled child will receive an amount equal to 1/2 of the parent's benefit. Upon the death of the parent, an eligible disabled child will receive an amount equal to 3/4 of the parent's Social Security benefit. So let's see how that works. Let's say that Helen, who's been disabled from birth, and she's receiving $1,040.21 in SSI monthly. That is the current maximum rate for most people on SSI. Helen's father, Earl, retires and gets $1,600 a month. Ella begins to receive $800 a month. Now we have to ask ourselves, what is that going to do to the SSI? Well, the receipt of childhood disabilities here is going to reduce her benefits dollar for dollar after the first $20. So her benefits will be reduced by $780. So now she's going to get $260.21 in SSI and $800 a month in childhood disability benefits. By the way, this is not going to interfere with Earl's payments. He's going to get the same payments. Okay, now she's only $20 ahead, and you might ask yourself, well, what's the big deal? But we'll get to that in a minute. Okay, so let's go to the next part. Let's say Earl dies and Helen begins to receive $1,200 a month. Once again, 3/4 of the $1,600. Well, the math is pretty easy now. That's going to completely eliminate the SSI, but she's going to get to keep her Medi-Cal because they're going to treat her as if she was on SSI because she originally was SSI eligible. Okay, so here's the next part of this, which is 2 years after being qualified for childhood disability benefits, Helen's going to be eligible for Medicare. Okay, now In this case, she's probably going to be qualified for Medicare and Medi-Cal. Now, if she doesn't really meet the Medi-Cal, there may be other options. So this is something you're going to have to explore. But let's say she's receiving IHSS and other benefits that you want to maintain. She will still be eligible for Medicare and Medi-Cal, but she'll have to stay below the $2,000 resource limit. Medi-Cal becomes the care of last resort, and it also covers long-term care costs. I'm going to take a little pause, and we're going to jump here because we have 27 minutes and 20 seconds to go, and I want to try to get through this in the next 15 minutes so we can leave some time for questions. Let's go with the new player on the block, which are ABLE accounts, okay? And I want to go through this, especially as we get into questions, because ABLE accounts are very useful, okay? And I don't want anything that I say to discourage these, but like everything else, ABLE accounts were created to be a simple way of saving and a simple tool for folks with disabilities. And have I mentioned that the word simple and disability are two words that just don't go together? Despite the complexity of this and trying to apply it, ABLE accounts have many, many benefits for persons with disabilities, and it's important to understand how they work. And keep in mind, ABLE accounts are neither good nor are they evil. Special needs trusts are neither good or evil. They are merely tools. So let's go through eligibility for ABLE accounts, and then we can jump to questions. First off, in order to qualify for ABLE accounts, there are two requirements. You have to show that you were disabled before the age of 26. For the vast majority of folks that are watching this program, if your child was developmentally disabled, this is not going to be a problem because your disability by definition started before age 18. Let's say instead your child has schizophrenia, for instance, and doesn't have a developmental disability, okay? That's very uncommon that schizophrenia does not begin before the age of 26, but it's very possible that your child wasn't receiving benefits until after the age of 26. So the other way you can do it is you can do what's called the self-certification. Now, different ABLE programs do this in different ways, but since we're in California, of course, we're going to want to look at CalABLE. And with CalABLE, as long as you certify that you can get a doctor certification that the disability began before the age of 26, you're going to be eligible. It's just that simple, okay? And so there's a lot of people that misinterpret this and miss this. For the vast majority of people watching this program, your child was disabled before the age of 18, so you don't even need to give this any consideration. Contributions to an ABLE account can be made by any person. Okay. And there may be a slide that'll come up with that as well, but a person is pretty broad, and that can even be payments from a special needs trust can be made to an ABLE account. And since in my world, we use a lot of special needs trusts, oftentimes that's what we do. We feed the ABLE account from the special needs trust, not the only way to do it, but it can come from any person. My niece, Erica, we make all of our gifts through her ABLE account so that she can have the use of it and it won't interfere with her SSI. And by the way, the other thing we use it for is to teach her financial literacy. Contributions are not tax deductible, but income earned by the accounts would not be taxed. And account withdrawals, including portions attributable to the investment earnings generated by the account for qualified disability expenses, would not be taxable. We'll go through what that means in a minute. Individuals are limited to one ABLE account, and the total annual contributions that can be made to an ABLE account, except for earned income, and we'll get into that in a minute, is up to whatever the gift tax amount is, and it just went from $15,000 to $16,000 in, and we should have changed this in 2022, okay? If you're watching this in 2020, I'm not sure how you're doing this. So we're watching this in 2022. So the new number went from 15 to 16. in 2022. Now, the most you can put into an ABLE account is whatever the state's limit is for normal 529 plans. And in California, that happens to be $529,000. Now, if you're just making your $16,000 contributions, it's going to take 33 years to get to that point if they don't change the rules. Okay. There is a limited amount that you could put in annually here, which is $16,000 a year. You can only have one ABLE account, and the most you can put in is $529,000. Now, here's another thing that gets somewhat confusing, and I have a program that in a video that gets into this into more detail. But if you're on SSI and you have an ABLE account, if your ABLE account goes above $100,000, then your SSI is going to be suspended. So, and what that means is that you would stop getting your SSI at that point here. But once it goes down below $2,000, then you would be able to go back on SSI, and this is important, without having to reapply. But in many cases, by the time we would get to the $100,000 mark, odds are your child won't be on SSI anyway. They're going to be on childhood disability benefits because you will probably have retired, might have become disabled, or maybe you passed away. It really depends on the individual. As far as Medi-Cal is concerned, even if it goes over the $100,000, the Medi-Cal programs would still continue. So beneficiaries do not lose their Medi-Cal eligibility if it goes over the 100,000. And anyway, the point of this is that if you use different programs, like for instance, if you want to use the Arizona program, I have no idea why you would here, then their limit is $412,000. Therefore, if contributions exceed $100,000, your SSI would be suspended if you use the Arizona ABLE program. But as long as the account remains below $412,000, your medical eligibility would continue. Beneficiaries can change the investments no more than twice a year. So if you're looking to day trade with that money, a Cal ABLE account is not the way to go, but you shouldn't day trade with this money anyway. Here, you can change the investments twice a year. And I will say Cal ABLE has some fantastic videos that kind of explain how that's done. As with any 529 plan, there's a range of investment options. So what you would learn is that they have different investment options, but from conservative to aggressive. And one of the values of an ABLE account for a person with a disability is it is a way to teach financial literacy and teach folks how to manage funds. Contributions are in after-tax dollars, but interest grows tax-free, just like a regular 529 plan. And withdrawals must be made for qualified expenses, or else the earnings portion would be subject to regular income tax and a 10% penalty. This program is overseen by the IRS, not the Social Security Administration. I know this might seem odd to people, but the IRS is traditionally a very disability-friendly program. I would not say that Social Security is a disability-friendly program. You guys be the judge, but I do this for a living. I would definitely not say that Social Security is a disability-friendly organization. To our knowledge, no one has yet paid a penalty for using this for a non-qualified expense in the entire country by using an ABLE account. Now, what is a qualified disability expense? And for brevity purposes here, this has a whole long list of things that it can be used for. The things I want to point out is it can be used for housing, it can be used for food, and can be used for basic living expenses. Let's go for basic living expenses. What's a basic living expense? And they don't really define what that is, okay? So that's a pretty broad category. So the only thing that most of us can come up with, which is not a basic living expense, is is using an ABLE account to make a gift, to buy illegal drugs, or gambling. I mean, that's pretty much the list. So tell your developmentally disabled or your disabled loved one not to use the ABLE account for illegal drugs, gambling, or making gifts. Okay. And by the way, I'm not urging you or even suggesting you shouldn't follow the rules, but even if you made a gift, the odds of having a penalty assessed against you is greater than zero, but it's not very high. Okay. Now, let me just mention a couple of things, because by design, this program is meant to be brief. I could do this program for 2 hours and not cover everything, but we wanted to cover the basics. Let me go to one thing with ABLE accounts here, and this is where you might want to go to our YouTube channel. And one way of doing that, if you like, is you could email Amy, AMY@gspt.org, and she can put you on our list and show you how you can get to our YouTube channel. Otherwise, if you go to the front page, it shows where our YouTube channel is. It has all sorts of videos on using ABLE accounts and ABLE accounts and dealing with things like food and housing. So let's go back to this. Remember, I told you that if you assist your loved one with housing and they're on SSI, they may be subject to a $300.33 reduction in their SSI because you're assisting them. Okay, let's say the fair market value of living in your home is $1,200 a month. Okay, now it's gonna be very hard for a person with a disability who's getting basically $1,000 a month to pay $1,200 a month. Okay, but let's say instead you were to put funds in a CalAble account, and the CalAble account paid you the rent, the $1,200 a month, pay you, the parent, for your child's living in your own house. What just happened? You just converted the gift you made in the CalAble account into your child's money. Your child is now paying you rent from their own money. So they're paying their own rent, and they will no longer suffer the $300.33 reduction in the SSI, because they're paying for their housing with their own money. Bottom line for what I'm telling you about this strategy here is that by running the money, I'll say it, by laundering the money through the ABLE account, you can actually increase the amount of SSI that somebody's getting, or prevent the decrease of, 300 times 12 is $3,600. $3,600 a year to a person with a disability is a huge amount of funds. And so that's one of the many uses of CalAble that can be very beneficial. The key is that education is the key. And once again, if you want to know more, email me, email Amy, look at our YouTube channel, and we have all sorts of videos that go into this in detail. I have right up there, as the trustee of the Golden State Pool Trust, and that's probably, if you're just looking for information, that's a good place to go, is to go to www.gspt.org, and that'll show you how to do it.